Hi, Zach here from Acre Security. Today we're talking about a compliance risk most clinics don't see coming, the check-in desk. This is part of our healthcare security mini-series, where we break down real operational weak spots in clinics and hospitals. In the last episode, we covered HIPAA and physical access. Today, we're zooming in on the front door. If you're responsible for clinic operations, compliance, or security, this detail matters. Follow so you don't miss the rest of the series. Let's start with something simple. The front desk feels routine, but it's not. Check-in feels harmless. It's routine. Patients walk in, give their name, maybe sign a form, and take a seat. But from a compliance and security perspective, the front desk is one of the most exposed areas in the entire facility. This is where identity is verified, where visitors are first introduced into the environment, and where access to the rest of the building begins. If that process is loose, rushed, or manual, it creates gaps, and those gaps add up. Most days, nothing happens. Compliance risk shows up on the day something does, where the risk actually comes from. In many ways, check-in still relies on manual processes. Paper sign-in sheets are visible to everyone standing nearby. Visitors may only verbally state who they're there to see. Delivery personnel or contractors may move past reception with minimal verification. Temporary staff might wear badges that don't clearly define their permissions. None of this is intentionally careless. It's just operational momentum. But healthcare environments must protect patient privacy and limit access to authorized individuals. That responsibility does not start in the server room. It starts at the entrance. If someone can enter without structured identity verification or clear permissions, that's risk. Not just to physical areas, but to conversations, screens, charts, and patient information that may be visible along the way. The risk is subtle. That's what makes it dangerous. High traffic amplifies small weaknesses. Hospitals and busy clinics manage a constant flow of patients, family members, vendors, contractors, volunteers, and staff. That volume makes manual tracking unreliable. Some hospitals report up to a 35% reduction in unauthorized access and related incidents after implementing advanced visitor management. That kind of reduction does not come from adding more guards. It comes from adding structure. When visitor identities are verified properly, when movement is tracked in real time, and when access to restricted areas is enforced automatically, incidents decrease. The system closes gaps that human processes simply cannot manage consistently at scale. Why traditional check-in falls short. Traditional sign-in was never built for today's healthcare complexity. They do not validate government-issued identification. They do not capture photographic records of visitors. They do not integrate with door access systems. And they do not generate comprehensive audit trails. In environments where compliance standards such as HIPAA and accreditation requirements demand clear documentation and oversight, those limitations become significant. If an incident occurs and leadership needs to know who was in the building at a specific time and what areas they accessed, a paper log is not enough. Healthcare facilities need traceability. What structured visitor management changes. A modern visitor management system introduces that traceability without slowing down operations. Visitors can pre-register before arriving, which reduces congestion at reception. Government-issued identification can be scanned and parsed automatically, improving accuracy and reducing manual entry errors. Live photos can be captured at check-in, adding an additional layer of identity verification. Custom visitor badges can clearly define access permissions, and when integrated with access control systems, those permissions are enforced physically at the door. That means a visitor's access is not just printed on a badge. It is embedded in the building security logic. Security teams gain real-time visibility into who is on site and where they are authorized to be. Comprehensive reporting provides documented records that support compliance audits and incident investigations. This is where technology begins to reduce risk rather than just react to it. How Acre supports this in healthcare. This is exactly why Acre's visitor management system was designed with healthcare environments in mind. It provides digital, secure check-in while integrating directly with access control infrastructure. Features like live photo capture, ID parsing from government-issued documents, real-time visitor tracking, customizable badge design, and advanced screening tools create a structured and controlled process at the point of entry. The system also supports HL7 integration, helping align visitor workflows with patient confidentiality requirements and visitor restrictions. And because Acre supports cloud-based access control and visitor management, healthcare organizations benefit from centralized oversight, remote management capabilities, and scalable deployment across multiple sites. The key is balance. Security should not interrupt care. It should support it quietly in the background. It's not about making clients feel locked down. A structured visitor process does not mean making clinics feel restrictive or unwelcoming. In fact, when done correctly, it improves the visitor experience. Self-service kiosks and pre-registration options shorten wait times. Clear badges reduce confusion. Automated workflows reduce administrative burden on front desk staff. Instead of adding friction, it removes uncertainty. Patients move through the facility more smoothly. Staff gain confidence in who is on site. Leadership gains visibility without increasing overhead. If this breakdown was helpful, make sure you subscribe and follow along with the rest of the series. Because in healthcare, the biggest risks are often hiding in the most routine processes, and fixing them starts at the front door.